Hello, my name is Curtiss. Today I'm going to be discussing some terms from Chapter 1, or Week 1 I should say, and giving an example of each. The first term is disease. Disease is an illness that causes some sort of physiological dysfunction in the body. It can be classified as physical or versus mental, acute or chronic, or diseases can be classified by the area of the body that they affect. The disease I'm choosing to give as an example today is benign prostatic hyperplasia, or more commonly known as BPH. BPH could be classified as a physical disease, chronic disease, and a genitourinary disease. Etiology is the next term. It would be considered the cause of a disease. With BPH, the exact etiology is not known. But we do know it is related to testosterone production in men over time that stimulates the prostate to grow. We do know that estrogen also plays a small role in that process, but it's predominantly testosterone that leads to the prostate growth, which leads to other problems with causing blockage of the urinary tract. It can lead to complete bladder obstruction, and then there's pathogenesis, which is how the disease progresses over time. With BPH, it typically starts with men in their 50s or 60s. It starts with mild symptoms like urinary frequency, urinary urgency. Men might complain about having to wake up often in the middle of the night to go to the bathroom, so the pathogenesis would be how the disease progresses from there. So it would become more severe as the prostate grows larger, causes more problems, leads to bladder obstruction, or that can lead to kidney problems, can lead to potentially bladder cancer, or even up to the point where surgical intervention would be needed. And then symptoms. Symptoms are defined as subjective problems that are presented by the patient, versus there's signs which are more objective or measurable that are observed by the clinician. And then a syndrome would be the combination of both signs and symptoms that make up the syndrome of a disease. As far as examples of symptoms with BPH would be, like I discussed, the urinary frequency or urinary urgency. Men would come in and complain about how often they're having to go to the bathroom. Typically people go to the bathroom 2 to 3 times a day, and these men are realizing that they're going to the bathroom 6, 7, 8 times a day. So that would be a symptom that they come in with. As far as a sign, an example of a sign would be something measurable. So like they do sometimes actual measurements of the size, physical size of the prostate, which gives you a number. So that would be more so a sign. And then, like I said, the combination of both signs and symptoms make up the syndrome. And then you have diagnosis. A diagnosis is a term that we apply to a specific problem. So when patients have these signs and symptoms, they come in and then they are diagnosed with BPH. Then we have complications. Complications are, negative aspects of the disease that can occur over time. An example of complications with BPH would be bladder cancer or a urinary tract infection. And then prognosis. Prognosis is kind of a prediction of how the disease is going to progress over time by the clinician based on the data that we have and what we know about the disease. So an example with BPH, if somebody has had the disease for quite a long time, their symptoms are getting more and more severe where there's almost complete bladder obstruction, the prognosis would probably be some type of surgical intervention is kind of where things are headed in that case. And then diagnostic tests. Diagnostic tests are anything that a provider is going to use to help diagnose the patient and figure out what the problem is. An example of that with BPH would be, well, you can have look at PSA, which is prostate-specific antigen, which is a marker for like prostate cancer. Another diagnostic test is a digital rectal exam. So those are a couple diagnostic tests just in regard to BPH. And that should wrap up the terms from last week, and thank you